Maryam fell down the stairs today, breaking her leg. It is a day she will remember. But for the staff of Al-Mushtahid Hospital, Maryam is just one of 1,200 patients who cross the doors of Damascus's central hospital every day. The hallways are cramped with people waiting to be checked, treated, or medicated. This has turned into the major medical facility in Damascus, and with more and more people seeking safety in the capital, already heavy strain on the hospital is growing. We toured the hospital with Dr. Aziz Haj Ali, the hospital's chief resident. Our camera is not always welcomed here. The doctor negotiates our way into the first patient's room. A young man in his 20s refuses to show his face. He lost an arm and a leg when a car bomb exploded in a busy street. He is just one of many.
We are here in the intensive care unit for burns. We are swamped by patients coming from distant provinces where hospitals were destroyed or put out of service. Severe burns are caused by air raids or the notorious rebel hell cannons, or simply the use of raw oil extracted in lawless parts of eastern Syria.
No matter how hard Syrians try to avoid the war catches up with them. Like Samah, a 10-year-old girl from Raqqa, now an ISIL stronghold. Her family don't want to be filmed. They fear reprisals once they return home. The free medical services in this hospital are a last resort for those who have lost everything. At the end of the day, Dr. Aziz shares his story. Unlike many of his colleagues, he chose to stay in Syria. A choice difficult to understand for many.
Sure, traveling to Europe isn't hard for doctors. It's safe and the money is much better. But who will care for the 500 patients we have in this hospital? All the famous doctors have left and the situation is getting worse with sanctions, as we can't buy spare parts for medical equipment nor Western medicine. As a public hospital, the sanctions are crippling us. Between keeping the ER on full alert all the time and tending to hundreds of severe cases, we are swamped.
The coffee break is quickly interrupted when Dr. Aziz is called again to the trauma and emergency room. 8 people have been severely wounded by mortar shells fired on a residential quarter in Damascus and its central hospital. This is just a day like any other. Alaa Ebrahim, CCTV, Damascus.